Yeah, I can start.
Hi, very good evening. This is our final video for Lex 2029. My name is Joel Edward.
My name is Ashutosh Kumar.
I'm Ashrita Prasad. My name is Umar Shafishamudam. I am Kisha. I'm Singi.
My name is Anshinda.
And today we shall be discussing a case to do with heart problem, right? So Mrs. Lim brought a dog, a 10-year-old Spitz, to the clinic and for a heart problem. And the doctor actually diagnosed the dog and prescribed it one furosemide tablet, half a furosemide tablet a day. But Mrs. Lim heard wrongly and instead gave the dog two furosemide tablets, one furosemide tablet twice a day, right? So two tablets a day. And what happened was that the dog experienced polyuria and general weakness. So this is the case that's been presented to us this very evening.
Okay, so first of all, what are Spitz?
Seriously, guys.
What are Spitz?
Spitz is a breed of dog with usually long, thick, and white fur, pointed ears and muzzles, and the tail is often curved.
So those are the aggressive ones, right?
Yeah. The one they were talking in ethology today.
They're the aggressive ones.
Yeah, that's true.
Yeah.
So I mean, there must have been a reason why the doctor actually diagnosed it this way. I mean,
Yeah.
what's the diagnosis behind it or something? I mean,
Yes, I think it's because of a heart problem, and then the pumping mechanism of heart is less effective. So
okay.
the veterinarian thinks that by reducing the fluid in the blood circulation, it might have the problem. That's why I think the vet prescribes furosemide for the dog.
So what
Because-
is like?
Yes.
What does active furosemide do?
Or what is
What do you mean?
furosemide?
What is furosemide?
What is furosemide?
Okay.
The dictionary.
Dictionary is here.
Sorry for listening.
Furosemide is actually a type of diuretics. It helps to reduce the amount of excess fluid in the body by increasing the production of the urine. So this swelling is the swelling of the body is also called as edema. So furosemide is a type of drug that reduces edema, and it also can lower the high blood pressure.
Right. So basically, it's to do it.
Reduces the fluid by producing more urine.
Right.
I think less fluid reduces the pressure.
Yeah.
Right?
That it will, and then probably your
Yeah, and that's why when Mrs. Lim gives the dog what?
one twice a day.
One
No?
means two tablets
Two
per day.
Two tablets per day.
Four times.
Supposed to be half only, you know.
It's 4 times over the
The
dosage.
potency exactly.
Polyuria.
Doesn't this also cause dehydration in a way, right?
Yeah.
Yes.
Which explains
Because you'll be
the
losing
general
water
weakness.
through urine, right?
Yeah.
Urinating.
So, but then you said furosemide. Why exactly that furosemide? That treatment of furosemide?
Yeah.
Why do they give?
That treatment.
Yeah,
Yeah.
I mean that administer that. Yeah. Okay.
Yeah, speaking of furosemide, you know, like how the mechanism.
Happens.
Yeah.
Okay, treatment.
Yes, yes.
Probably why that treatment first, right?
Yeah.
Because
Yeah.
why would the doctor give that drug? Or is it like given with any other drug?
Well,
Probably.
usually, like if you have furosemide, right? So the doctor will actually prescribe. I mean, if you get furosemide, something what do you call it? Something. You mean overdose?
Overdose.
Overdose, yeah.
So what the doctor will do is doctor will prescribe diuretics. Diuretics is like water pills to help to get rid of the body of the unneeded water.
Right.
So what kind of diuretics is usually for thiazide diuretics is actually for mild heart failures and all that. But if let's say you want to go for
Thiazide.
Thiazide.
Yeah, it's just
Thiazide.
a type of agent.
Yeah.
So you have thiazide agents. Those are more mild.
And then you have potent drugs as well. Potent drugs is like loop diuretic furosemide. Okay, that is the Lasix is a trade name. Lasix is a trade name. So these are actually used for severe fluid retention. Okay. Normally we get rid of this excess fluid because we want the blood or the heart to pump. Okay, and then to control the pressure. So people who got heart failure, they don't respond to this type of drugs.
So like you have to give a combination or something,
Yeah.
right? Is it?
But this furosemide seems like it's dangerous because it produces too much urine and your body might get dehydrated.
I mean, that's why you have to prescribe it and
Yeah.
write prescription, not.
I guess it also depends on the dog's size, age,
Yeah.
all that factors come into consideration.
Yes.
I think.
Any side effects of this?
Yeah, I think the vet will consider all pros and
any medication, right? This one also has this one also has side effects, but it has certain side effects, but it doesn't mean that each single drug will show that kind of side effects. Yeah, I mean like it depends on the individual as well. So some of the side effects include decreased level of sodium, potassium, magnesium, or calcium in the body. I think this is because when you lose the fluid,
Yeah.
it also
all the
decreases.
ions.
Yeah.
Because it takes the ions out.
Yes.
Right.
Yeah, so it has low blood pressure, and then it causes dizziness, headache, weakness, drowsiness, and also a disturbance of the gut. So it has diarrhea and it feels nauseous,
Nauseated.
and then and it goes vomiting, also abdominal pain. So I think this is all because of dehydration.
Right. I mean, just like you were saying that that this coming out of sodium and everything, right?
Yeah.
So I mean, but what is the what is the
Physiology.
what's the
Yeah.
mechanism behind it? I mean, why would it
Yeah.
not be able to?
The physiology behind
Yeah,
Yeah.
the physiology behind
Oh.
it. Oh.
Well,
Nice.
from
Yeah.
previous knowledge, the data suggests that furosemide.
The doctor.
The doctor.
The doctor.
Oh, okay. That is some new word.
Pigeon slang.
Pigeon slang.
The data suggests that furosemide acts to block sodium chloride and with sodium chloride reabsorption, particularly in the loop of NV. Okay.
In
Yeah.
your kidney, right?
And in more cortical distal diluting segments. The magnitude of its effect suggests that it may also interfere with mechanisms and other sodium chloride reabsorption parts in the body. Yeah, so ion exchange sodium reabsorptive mechanisms appear unaffected and become overactive during drug administration, thereby accounting for the observed increases in potassium and hydrogen ion exchange.
Oh.
And because of its properties, furosemide was especially useful intravenously as treatment of acute pulmonary edema and in this case heart problem. Yeah. And in these difficult situations for maximum diuresis and to avoid problems associated with potassium ions, hydrogen ions or calcium ion depletion, intermittent therapy added to a maintenance schedule appears advisable.
It's like what Dr. Go said, right? When
Yeah.
you use your furosemide, you have to give it with other
Yes.
medications also, right?
Because I remember it said the maximum duration is 2 weeks, right?
Yes.
For drying up.
Correct. But that also is only in its normal moderate dosage only.
Imagine this stuff.
Yeah.
4 times.
4 times a day, you know, man. Come on. Alright, but then I mean there should be certain situations that we cannot use it at all.
Yeah,
right?
Yes.
since there are so many side effects. we
Yeah,
see.
I mean we shouldn't like I mean
I mean, there are many conditions we cannot use this furosemide. So the first one and the very important one is the low volume of circulating blood, that is hypovolemia,
Yes, of course.
and also dehydration, kidney failure causing no urine to be produced, and kidney failure caused by poisoning of liver or the kidney. This is due to hepatic coma. So due to hepatic coma, the kidney or the liver will be damaged. Very low potassium levels. This is also called hypocalcemia. Very low sodium levels and also allergy to sulfonamides. So that is in antibiotics basically.
right.
And also if the animal is breastfeeding, it is not supposed to be given furosemide because it will basically be fed to the baby
Probably I
and
think
it
it
will
would be
Oh,
because
yeah.
it's the same circulatory system, it's not good.
Yeah, so basically, it's not supposed to be prescribed for animals with
kidney
problems,
problems,
Yeah.
liver problems, and
have
heart
baby,
problems.
give it
Yeah. no, heart problem without the kidney problem.
Ah, yeah.
That's
and
right.
then a mother that's feeding his baby as well.
Yes, I think what pregnancy or only if it's breastfeeding.
Breastfeeding.
Oh,
Pregnancy also
I think
should be
pregnancy should have a
like-
certain amount of.
It's quite dangerous. Any way to reverse the effects? Since we have overdosed the drug, remember?
Mm-hmm.
Any other way to reverse the effects?
I think probably that what we can do is that we could just probably lessen the effect. Like, you know, like how Dr. Go said that you don't take out the drug straight away.
Yeah, I think you have to slowly reduce. I think
Slowly
the drug will
reduce
go
and
stop.
also add in other drugs that you can use.
Maybe some simple supplementary treatment.
Yes.
If it's a drug, right? Don't you think like
No, Enterostato is poisoning.
Toxicity.
Yeah,
Maybe
that's
like
toxicity.
glucose
Nice. It's better IV.
Glucose like glucose will usually
Yeah.
Flush it out, right?
IV,
Because you're taking drugs.
maybe because dehydrated.
I mean,
Yeah.
IV, glucose
Yeah.
cause dehydration to add fluids to the body.
I mean,
Fluids
or
and
there could,
ions.
yeah, correct. Or there could, you could probably just use like a fluid therapy, lah, right? Like a sodium chloride, because
Yeah.
like your furosemide is taking it out, so you pump the body back with it, lah, right?
And
So you-
slowly as you reduce the
let it-
amount of furosemide.
yeah, then let it.
Thank God it's not permanent damage.
Yeah, I don't think it is because it's just a simple. It's just your iron balance in you,
Yeah.
right? It's not a very
Yeah,
big thing.
anyone wants to add anything else?
Yeah.
I think we can just
I think right. Okay, so basically, we have a case study here whereby the whole problem was a furosemide overdose, right? So I think all that we can do is that since the overdose is already done, and we can see that the physiology of furosemide is that it attacks by not allowing the body to reabsorb sodium chloride and all the different ions. So basically, what we can do is that to slowly lessen the dosage of furosemide by not taking it straight away, let the body gets into a shock, and also probably give it fluid therapy to help balance out the effect of furosemide. And probably in 2 or 3 weeks through that therapy, this dog, this 10-year-old Spitz, can be fine again. So yeah, I think we're done for today. Like,
Okay.
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 Thank you so much, guys.
Thank you.
Bye. Good night.